Hi, I'm Masha Blanchard, the founder of Cholesterol Lowering Academy, the #1 place for working women to learn time-efficient strategies how to lower cholesterol through lifestyle and reduce other risk factors for heart attacks and strokes. Today we're going to talk about cholesterol. You will find out what cholesterol is, what function it has in your body, what happens when you have too much cholesterol, and you will learn some very interesting facts that can change the way you look at heart disease. If you have family history of heart disease, if you have fears about heart attacks and strokes, if you see your loved ones suffering from the consequences of major cerebrovascular disease and you are thinking, what if this can happen to me? The fact that you will learn in the video will be very empowering. They will show you what you can do not to become the part of statistic of this #1 cause of adult death and disability in the developed countries, which are heart attacks and strokes. What you can do not to become one of the people who suffer from that. It will show you the most effective way to reach that goal, and it will show you the measurable result you can try to reach right now, so you can be confident in your future tomorrow. Okay, and let me know what you think about this empowering statistic. What is cholesterol and why we care about it so much? Cholesterol is a fat molecule. There are two types of it. One is made by liver, and second comes from food. It comes from saturated fat, trans fat, dietary cholesterol. Body needs some cholesterol for hormonal function, cell membrane structure, and other functions. So you might think, well, if my body needs cholesterol, I probably can eat it. But the answer is body makes all the cholesterol it needs, so you don't need to consume it in the food sources. In fact, it's when you do consume cholesterol sources, then most likely you will be like a majority of people in the West who have too much cholesterol and blood, which refers to blood level cholesterol, because cholesterol travels in blood, and what it does inside the blood vessels, it does two things. It scars the lining of blood vessels and it builds plaque. And none of the above is a good thing. So when there's a plaque, there's a scars in the arteries, it's so much easier for the plaque to start to form in those places. And plaque inside the arteries is a big problem. Why? Because it doesn't let the blood to flow freely. You can think of it as a broken car on freeway. And it slows down circulation, or organs downstream suffer. But the worst thing happens when this plaque ruptures. So this blood clot, which forms as a result of this process, ruptures, and it completely blocks the circulation inside the organ. It can be heart, it can be brain, and that's how heart attacks and majority of heart attacks and strokes occur. Or it also can block the circulation in the leg, and that's deep vein thrombosis, or it can stop in the lungs, and that's pulmonary embolism. And what happens when the blood flow is reduced or blocked? Well, cells starts to die. Why? Because blood brings oxygen and nutrients to cells. In other words, blood brings life. And without blood flow, cells starts to starve for oxygen. That's why people have terrible pain during heart attacks and strokes. What happens if cholesterol is too high? We know it's major risk factors for heart attacks and strokes, which are the two leading causes of death and disability. But also poor circulation. We know it comes from plaques, arteriosclerosis plaque. It can cause vision problems, it can cause skin problems, premature wrinkles, skin ulcers, and many other circulatory problems. So now the question, how this plaque gets built? There are two steps. First step, inflammation, which is injury to the arteries. It can cause by dietary fat, we talked about that, also by smoking, high blood sugar, high blood pressure. Those things that damage the arteries. When arteries are damaged, the body tries to recover from this damage by putting kind of like a band-aid on the scar, and that band-aid is a plaque. And guess what this plaque is made of? You got it, it's mainly cholesterol. And So that's, you can see that how cholesterol does this double job. It injures the arteries and it and participates in the plaque. And we know that there are other risk factors. That would be smoking, high blood sugar, high blood pressure. And you can see, well, I clearly see that it's very important to have clean arteries, clean of plaque. What would be the benefits? Tell me more about the benefits. So if your blood cholesterol is low, here is the quote by Dr. Alexander Leaf, chairman of the Department of Preventive Medicine at Harvard Medical School, and this was published at the New Journal of Medicine. This Dr. Alexander Leaf says, in societies in which the mean cholesterol levels are 150 or lower without the use of drugs, coronary heart disease is essentially unknown as a public health problem. This is such a huge statement. This gives us so much hope that we can prevent becoming a part of statistic. We know heart disease is the #1 cause of premature adult death and disability, and this statement done by this physician gives us tools. It shows us the goal that we can achieve. It's a measurable goal of total cholesterol that can be achieved through lifestyle, and it gives us so much hope that we don't have to be fearing heart diseases. We don't have to be suffering from them. What we need to do is take massive actions to achieve the goal. Another study, it was done over 50 years. It shows the same results. Framingham Heart Study, the 50-year project run by the National Heart, Lung and Blood Institute by Boston University and other academic collaborators. They collected and analyzed medical data over several generation of citizens of this city, and they saw all over all the years, and it was 50 years, that no one in Framingham who maintained a cholesterol level lower than 150 had a heart attack. Again, no one who had a cholesterol level less than 150 had a heart attack. This is so huge. It means that we can have we can be so confident in our future health if we follow this direction. So again, 150. The leading physicians, such as Ornish and Esselstyn, recommend to keep the total cholesterol less than 150 because of the above mentioned facts. Just for information, mainstream recommendations are still less than 200. And if you look historically, just a few decades ago, the mainstream recommendation for cholesterol were less than 240. Standards change, sometimes more slow than we would prefer. And the benefits of having cholesterol less than 150 are very well said by Dr. Esselstyn, who is from Cleveland Clinic, by the way, and who led a 20-year study, and it was published in the American Journal of Cardiology. Esselstyn says that you can become heart attack proof. That's exact verbiage that he uses, and I love this expression, heart attack proof. And that can be achieved if you reduce your total cholesterol below 150 and LDL, which is bad cholesterol, less than 80. Because in that, if you achieve those goals, you cannot deposit fat and cholesterol into your coronary arteries. And of course, without plaque blocking your arteries, you do not have risk of heart attacks and strokes. The major portion of them, the most common type of heart attacks and strokes will not be a threat to you. How can this be achieved? Both of the physicians, Ornish and Esselstyn, had their patients reduce their cholesterol through lifestyle. They only used medications in the beginning when the patients would show up with like 300 cholesterol. They would use statins, cholesterol-lowering drugs, but later the goal was to achieve that through lifestyle. The first part is nutrition. The programs of those two physicians are almost identical. It's very low fat, whole food, plant-based diet. That's the nutshell of their recommendations. Why? Because by following these recommendations, you stop consuming the building blocks of heart disease. And let's look at the more details what they allow to have. What are the rules of their dietary programs? First of all, you can have all the fruits you have, green, yellow, red, especially green leafy vegetables, except avocado, because avocado is the only vegetable that's not allowed because of the fat. All legumes, all whole grains and their products such as breads and pasta that are made from whole grain, 100% whole grain, all the fruits. And what's not allowed, animal products not allowed. Why? Because of the saturated fat and cholesterol. That's different from mainstream recommendations who are still recommending fish and chicken. Both Esselstyn and Ornish say fish and chicken have too much fat, and that's unacceptable if you want to achieve very low cholesterol and be confident in your cardiovascular health. They also say no dairy products, no oil of any kind. Why olive oil and canola oil are not allowed? Because even those oils have saturated fat. Olive oil and canola oil have the least percentage of saturated fat. That's why they're so-called heart healthy. However, the leading researchers says that's not good enough, that's not low enough, so they say no oil at all. They're very clear on that, on those recommendations. And you might think that I'm not sure if I should follow this recommendation because my cardiologist says fish and olive oil are okay, and that's Mediterranean style, Mediterranean diet. And I like to think when I make decisions, I like to look at results. Those two cardiologists, Esselstyn and Ornish, their results are fascinating. They through the hundreds and thousands, even in Esselstyn program, he has thousands of people who went through his program. Not only they started to feel better, the testing demonstrated the arteries cleaned up, and the multiple testing demonstrated their condition were reversed. Esselstyn allows fat-free milk and egg whites. That's his difference. Ornish allows that, and Esselstyn says completely no animal products. Also, exercise and moderate exercise and stress management. You might think, well, that's impressive, but it seems too hard to follow. It looks like this recommendation required too much time for cooking, exercising, and too much time. And this is why you want to watch videos of cholesterol lowering academy, because that's the #1 place for working women to learn time-efficient strategies to lower cholesterol and to reduce other risk factors for heart disease and strokes. Okay, we'll see you in the next lesson, and until then, live heartily and treasure your heart.